I will go ahead and kick it off to our presenters. Thank you so much for being here tonight and sharing with us.
Thank you. Thank you for inviting us. I'll introduce myself first. I'm Amy Doling. I'm in the Department of Biology, and I teach microbiology and immunology in a couple of classes about HIV and also general biology. And I've been here, will be my 19th year.
Hi, I'm Jacy Downey, and I teach in the Health Services Leadership Program. I have a background in public health, and I teach a class here on campus in epidemiology.
And my name is Katie Lee, and I'm the Director of Health Services. I'm a registered nurse. I've been a nurse for 20 years now, and I just completed my 8th year here at Simpson. Okay, I'm going to start us off by just giving you a little background on some of the resources that we used to lay the foundation for our color-coded system. And we've also included the links, so if you're not aware, you can reference them afterwards when the slides are available. So we primarily focused on the CDC, the Center for Disease and Prevention. We also focused on the Iowa Department of Public Health, and we used the resources available from Warren County Public Health. Another one of our valuable resources came from the ACHA, which stands for the American College Health Association. So with the combination of primarily these four resources, Amy and Jacy and I gathered the information and used this to lay sort of the foundation for the color-coded system. And then the last resource we have listed there is the COVID-19 coronavirus.iowa.gov. This is all the data that's collected in Iowa, and we reference this for our own purposes, but we'll also be using it more regularly to monitor the COVID numbers or cases in Warren County specifically.
So I will take over from here. We're going to talk a little bit about COVID-19. I'm sure most of you feel like experts at this point, and so we won't spend a lot of time on it, but the disease is called COVID-19, but the virus is often referred to as novel coronavirus SARS-CoV-2. And currently there are tests, a variety of tests that are being used, one in which has to do with isolation of viral RNA, and another is a point of care test, which gives the rapid antigen test. We, as you've probably heard on the news, there are some mobile testing units around, and then of course, certain clinics in the Des Moines area are focusing on coronavirus testing in particular. So talk a bit about symptoms. Interestingly, as you've read, up to 40% of individuals are going to be asymptomatic. So not everyone will present with symptoms, which of course is going to make things more complex. When they do have symptoms, oftentimes what you're seeing as the top symptoms are severe respiratory distress, shortness of breath, a cough, or a new loss of taste or a new loss of smell. Therapeutics that are currently available include not many, this is a virus, so there aren't many, but they do have some steroid use, some antiviral use, including remdesivir, and convalescent serum. And of course, we're all hoping for some successful vaccine candidates to come through. They're at the point of entering some clinical trials right now. So that's good news. As far as risk factors that we are concerned about, so COVID-19, again, that's what we're calling the disease. So some risk factors where an individual might experience severe disease include some pre-existing complications related to diabetes, kidney disease, smoking, obesity, advanced age, of which we're qualifying here by saying 65 years or older, COPD, or being immunocompromised. So those things are the short list of what seems to put individuals at greater risk for severe disease. What do we know about transmission? So again, this is a novel infection, so we are learning every day. What we found that our evidence is supporting is that the strongest evidence is supporting the idea that most transmission occurs by direct contact, meaning that if you are within 6 feet for more than 15 minutes, you can have contact through respiratory droplets. That's where the strongest evidence lies. There is some other evidence that talks about some transmission via surfaces, so doorknobs, pens, those sort of things. And then also some evidence that talks about spread that's airborne via aerosols. And so that would be why your dentist office might not be doing polishing, or why anesthesiologists might be at increased risk, those types of transmission.
Okay, so I'm just going to give you a little background on who we are and how we came to be. The three of us were asked by the crisis management team we call ourselves the Campus Health Subcommittee. We were formed from the crisis management team, and we were asked to basically gather all the information that's out there from the CDC, the IDPH, and ACHA, and not only gather the information, but comb through it and then lay it out in a foundation for our college campus. The other component that we did is that we wanted to establish, well, the purpose of our job wasn't necessarily to figure out how like Res Life was going to operate in COVID, or dining services or campus activities. Our job was specifically just to lay the foundation from the data or the information from the CDC and IDPH and ACHA, and so that they could, so those specific departments could then figure out how they would operate in a new COVID world. We used some guiding principles as we were coming up with our color-coded system. We knew that we wanted to maintain the Simpson College experience as much as possible. And we recognize that we are a residential campus and students are coming from all over the country and from parts of the world. We wanted to make sure that we offered high quality academic experience, which includes face-to-face instruction as much as possible. We wanted to provide that college experience with extracurricular activities as much as possible. Another guiding principle we used is that Simpson does offer that small classroom experience with sort of that low teacher to student ratio. And our students have access to faculty, staff, and coaches. And we didn't want to take that away. And so these were part of our guiding principles when coming up with our foundation. The other important piece is that we needed to maintain a safe community. We wanted to maintain safety for our community. We need to protect the vulnerable. We also needed to develop some sort of monitoring system so that we can just keep a pulse on the COVID activity on our campus, so our students, staff, and faculty are safe, and that we would know when levels are getting too high, and then we would need to alter our plans. So naturally, this, like many other COVID situations, come with challenges. These were some of the main challenges that we struggled with. We recognize students come from all over the country and from different parts of the world. And they're not just here to study, but they're here to study, to work, to play, to eat, to sleep, and to live here on campus. Another challenge that we discovered is when we were talking about social distancing and trying to keep our students at least 6 feet apart, we recognize that some of those classrooms are quite small, and they were not always accommodating for the size of our classes and maintaining 6 feet social distancing. We are a residential institution, and we have communal living and communal dining. So students are very close in proximity to one another. And we also recognize that students will engage in activities outside the classroom, and sometimes outside of Simpson campus, parties, activities, even employment jobs. Another challenge, the lack of COVID-19 testing in Warren County. There is none at this time, but there are some testing sites in Iowa. And then we recognize that the data is ever evolving with COVID-19. And even today, we recognize that there was maybe 2 weeks ago, we had something set in as a plan, and then today things have evolved and we've had to sort of shift some of that. So, and this is not going to be the end of it. It will continue to evolve.
So I recognize that this is too small to read. I'm going to go ahead and zoom in. Just wanted everyone to see the full guidelines. And so I'm going to take you through the color phases that we established for being on campus, and then also take you through the guidelines that we're going to use to transition from one color phase to another. So we knew early, fairly early, I think we had some discussion, that we wanted to have at least 4 phases. So a phase that's off campus, so we're not safe to be on campus, we need to be remote. A phase where we're essentially in a place where we either have a vaccine or so much testing that we are less concerned. And then we wanted to have 2 on-campus phases. And so that is how we came up with the color-coded system of red, orange, yellow, and green. It's probably fairly obvious, but red is sort of the hot zone of we're not on campus, and green is we're on campus fairly normally. So I think probably red is self-explanatory. Nobody really wants to think about red or talk about red too much, but it is an option. Obviously, we're essentially in phase red during the spring, and this would be virtual learning, working from home, and minimal presence on campus, potentially only essential workers. The next phase is going to be what we call the orange phase. And the 2 on-campus phases will be orange and yellow. Orange is the more stringent one. And we decided also fairly early on that regardless of the data in Iowa or in Warren County, we as a campus are always going to start on orange phase when returning from a major break. And when I say regardless of the data, I don't mean that the data are so horrible that we're being dangerous, but what I mean is if we have very low viral activity in Warren County or very low viral activity in Iowa, we are still going to come in phase orange as a campus. And that really harkens back to something that was talked about earlier, that we're drawing students from across the country, we're drawing them from around the world. And epidemiologically, when you mix those populations, that really is your danger zone. So again, after any major break, we're going to automatically be on phase orange. And I should also point out that that is one of the guiding principles that also led Cabinet to make the decision to have essentially no breaks. So we'll come on campus, we'll go straight through to Thanksgiving, and then students will take their finals from home so that we minimize those transitions. So in orange, we want to have people distancing by maintaining 6 feet or more from others. And anyone who knows me well will be disappointed if I didn't point out that that was almost exactly 2 basset hounds lined up head to tail. So if you are not sure what 6 feet is, that's 6 feet. Masking is going to be absolutely essential. Again, we're hearing about this in the news quite a bit. So either masks or appropriately sized face shields, and we define that as a face shield that comes below the chin, will be required when inside all non-residential buildings, including private offices with more than 1 person present. So if I'm sitting in my office alone, I can be unmasked if I choose to be. Someone coming in would then, if someone came in, then I would be required to put a mask on in orange. That person coming in my office would also need to have a mask on. We're also going to require masking when outside buildings if social distancing can't occur. We know most of the time outside you can maintain 6 feet. Masks will also be required for campus housing public spaces. Much like in our offices, we're not going to expect students will sit in their dorm room with masks, but in any public dorm spaces, they will be. Group gatherings of, if any, no more than 10 outside of the classroom. And this was based on early guidelines that Iowa had set forward in, I guess, April-ish, late March, early April-ish, that the governor had instituted. Our classroom size will operate at 50% of capacity if space restrictions do not allow for 6 feet distancing. I can tell you, because I was one of the people to walk around and mark out the classrooms, they're all marked out at 50% capacity. And what we mean by that is if a classroom would normally hold 48 students, only 24 students will be allowed in that classroom under orange. And we have arranged the classrooms to have as much social distancing as possible, and every other desk or every other table has been marked off as not to be used in orange. And then we also are going to have a Moodle check-in, which is going to be a way to monitor symptoms across campus, and we will talk about that a little bit later. That will be required of all faculty, staff, and students Monday through Friday. And I think we have decided that we will pull the data for the day about 10 a.m. And so the expectation is that people will sign into Moodle. For those of you not familiar, this is our education platform that we use for classes. It's very simple. It should take about 30 seconds at the most. And the expectation is that before anyone leaves their house or their dorm room, they will do the Moodle check-in. So after at least 2 weeks in orange, but not necessarily after 2 weeks in orange, we will assess, or cabinet will assess, as to whether or not we are ready to move to phase yellow. And yellow phase looks fairly similar to orange with a couple of differences. One of them is if you are in your office with one other person present, so in a private office with one other person, it is up to the discretion of the office owner as to whether or not you and the other person are going to be masked. We do recommend that one wears a mask, but we're not going to require it. Same thing for campus housing, public spaces. It's going to be heavily recommended that masks are worn, but not required. But masks are still going to be required inside all non-residential buildings and outside if unable to be 6 feet apart. Group gatherings, as Katie said, or Jacy said, the data are evolving almost minute by minute. So we are not in a position right now to determine exactly what the group gathering size will be under yellow, but it will be determined as we get closer. It will fluctuate, presumably based on both state guidelines and the viral activity on campus and in Warren County. With the discretion of the instructor, we're really going to leave this up to the instructor. The classroom size may operate at 100% capacity if the instructor chooses to do so. We obviously continue to recommend distancing in the classroom, and Moodle check-in will be required of all students, faculty, and staff Monday through Friday. And then green, which I don't think we're going to have to worry about in the fall, but just in case, green will be when a vaccine is available or reliable testing is highly accessible and fast. Mask use at this point, we think, it's a little far ahead to think about this, but we think will be at the discretion of the students, staff, and faculty, but we will be requiring a Moodle check-in for a significant period of time in green phase, just to be watching what's going on campus. Okay, so we thought we were done here. We were hoping we were done, and then we realized that we needed to give guidelines for our trigger guidelines for how do we know if we're ready to move from orange phase into yellow phase. That's where we're hoping we're going to go, or orange, or yellow back to orange, or heaven forbid again into red. So the next thing that we did is to set these trigger guidelines. I do want to just make sure to be super, super clear that these are general guidelines. It is not going to be our decision as to whether or not the campus moves into orange or yellow or red. That will be assessed by cabinet. Okay, so again, these are broad, much like the earlier guidelines were broad enough to allow each of the departments, Res Life, food services, to kind of set their own plan. These are broad and yet specific, if that makes sense. So the guidelines that we're going to look at to move from orange to yellow would be two things need to happen. One is that there's no uptick of confirmed COVID-19 cases on the campus in 14 days, and the number of new cases reported in Warren County has either declined steadily for 2 weeks, or the percent of positive cases to the number testing remains stable in Warren County. And I'm sure everyone's aware that when you look at the metrics, you really want to look at number of new cases, but also most certainly the percent positive cases, and that's what we're talking about here. The move from yellow back to orange would be considered if either one of these two things happen. Either there's an uptick of confirmed cases on the campus over a 3 to 5 day period, or the number of new cases in Warren County increases steadily for 14 days. So I do want to point out, and you'll see this pattern, that as we move from like a high alert phase to a lower alert phase, there's going to be several things that have to happen, but generally only one thing has to happen to move to a higher alert phase. So here we have and here we have or. And then yellow to green, again, will occur hopefully when the majority of the campus community has been vaccinated or is otherwise immune, or testing becomes much more accessible, faster, and reliable. And finally, the trigger for red, there are three scenarios, at least three scenarios that could push us into red. One is doubling in daily numbers of confirmed cases in residential students over 3 to 5 days. So what we're really looking at here is if on day 1 we have 3 diagnoses, on day 2 we have 6, and day 3 we have 12, that's indicating exponential spread. That's bad, obviously. Inability to manage contact tracing and or housing needed for students with confirmed cases or those exposed to someone with confirmed cases. So we will have a significant number of quarantine and isolation rooms on campus, but obviously we don't have enough to quarantine and isolate every single student, or would we want to. And then finally, significant absenteeism due to COVID among faculty and staff. That's going to preclude the ability of the school to provide appropriate academic and support services to students.
All right, so we've mentioned the Moodle check-in a couple of times. This is just actually it should say draft because it is a draft, but it's a screenshot of the really short quiz that we're going to ask faculty and staff and students to take Monday through Friday, as we've been talking about. And a lot of consideration has been put into which questions we should be asking, recognizing that it will be, it needs to become habit to do this every day, but we also want to make it something that's quick and simple and doesn't take too much time. Because we are a decent sized campus and we don't have a bunch of Katie Lees able to come and take temperatures at the door of every building every hour of the day, we are going to put a lot of trust in our community campus that they all want to be here and that we all want to keep our campus moving along and be able to enjoy the college experience. So we're going to trust that everyone will take their temperature before leaving their living space. And so the first question will be, is your temperature 100.4 degrees or higher? That's the number that the CDC and other reputable organizations are using to determine fever. So that's one of the first questions. That one's pretty easy to expect and understand that that would be on this list. Next would be a list of 4 different symptoms that we have decided based on, again, evolving data, what are the most common symptoms that are being connected to COVID-19. So the first one, well, first I should say they're all new onset. So we recognize that people have allergies, that some people have, some coughing that is associated with their allergies and whatnot. And so we're asking everyone to understand we're talking about new onset of cough that would be unrelated to seasonal allergies. Shortness of breath, loss of sense of smell, or loss of sense of taste. Those last two, the sense of smell and taste being lost, those are kind of hallmark type symptoms that we feel probably do give us a heads up that this might be a case of COVID. Additionally, the next question talks about if the individual has been tested for COVID in the last 14 days, we're trying to monitor trends. That's one of the most important things that we'll do with this data is monitor trends, as you just heard Amy talk about the triggers. So we're going to keep track of that as well. And then we want to know where they're at with that test. So have they been, are they positive, are they negative, or are they still waiting for results? That's sort of one of those options. And then an NA, of course, if it does not apply if they've not been tested in the last 14 days. So at this point, where these are the questions that we are working with, each of these questions will have a pop-up when they select an answer, and that pop-up will give them a response which gives them some direction and education. So one of the main goals that we had with the Moodle check-in, number one, was to use a tool that we have on campus that students, by all means, and faculty and staff are going to easily become accustomed to using, that is simple, accessible, and that can give feedback and information. We also wanted it to be like a storage house. Where do you need to get the information on how what are the important symptoms that we should be watching for, and where is the information, the health information that's available to us. When students to get into, and faculty and staff to get into habit where they know where to go for information. So those pop-up responses will give them reinforcement on a daily basis of how the behavior that we need to maintain on this campus to be safe and have access to information very easily. So where is that information going to go? Well, to be honest, we recognize that we want to honor confidentiality, but we also are in the middle of a pandemic of a communicable disease. And so that requires that we have access, that a small number of individuals, professionals, have access to information so that we can help monitor the situation. So student data will get directed to Katie, the Director of Health Services, and employee data will go to Mimi and HR. And so it will not get shared with the larger campus community. It will go directly to those individuals. And IT has been working very hard to be able to code the system so that it is only Katie and Mimi that will get access to that information, and everything else will be de-identified. So then what do we plan to do with data? Why do we need the data? Well, most of this is pretty obvious, I would think, but here we'll do a little explanation. So first, we want to be able to identify trends. We most definitely need to be able to see if we have increasing cases, for example, because we talked about one of the triggers being an increase of cases over a 3 to 5 day period. So we definitely need to monitor what's going on in our campus community. We also need to be able to follow up with those that have symptoms. Again, Katie's position and her office will be doing some of that. And then also those that are not checking in regularly. If they're not doing the little check-ins, and we need to be able to see that trend as well so that we can make sure that we are accounting for them, checking in with them, educating them, and trying to keep this system in shape so that it's actually giving us valuable data and not garbage data so that we can utilize it. We need to be able to collaborate with campus leaders as necessary. So Amy mentioned how this committee is really, did some interpretation of data and put out some basic guidelines, but we're certainly not equipped, nor is cabinet equipped to be able to say how to, what housing or food services or any different department should be doing as increase in cases or decrease in cases. So we want to be able to collaborate with those leaders as necessary, so then they have the right information to be able to use their expertise to run their department as appropriate. And then there'll be some basic reporting of data to the community. And so we'll be able to provide that information from the Moodle check-in as well. And then this is our last slide, and I guess it's the rah-rah slide. And jump in there, Amy and Katie, if you like. But basically, we've already sort of put this out there, but this is one of those things where I feel like we all involved campus, students, faculty, staff, and the greater community, we really want one Simpson mentality. We really need all of us to bond together on the behalf of trying to have the valuable campus experience that most of us got to enjoy and that we want our students to be able to enjoy and appreciate. So this idea that we do some things that are uncomfortable and unpleasant perhaps, but we do it because we care about Simpson and we care about the students that we serve and the faculty and staff that work here. And so we just want to leave making sure that you all feel how important it is to feel the One Simpson vibe and to take it to heart and to feel like, we do this and we do it, if we do it well, we do it for a shorter amount of time than, as much short of a time as possible. So we do appreciate you stopping in and listening to us. And of course, we, want to leave by saying, we'll answer your questions as best we can, but we are really not decision makers. We're interpreters of information. And so some of those questions we may not be able to answer, but we'd sure love to let Amy fire away with whatever you see there, Amy.